Chagas disease is a global health problem which can lead to severe heart disease, leading to high morbidity and mortality. To fight a problem, we must know how many people are affected by it and where they are. We are here with Professor Antônio Ribeiro from the Faculty of Medicine of the Federal University of Minas Gerais and Head of Research and Innovation at the Clinical Hospital. Professor Tom, how would you describe the current knowledge on the burden of Chagas disease?
As you know, Carol, Chagas disease is a neglected disease, so there's a shortage of data in Chagas disease. We have studies on the prevalence of the disease. They are relatively old and scanty, and we have also an under-notification of the number of deaths in many countries. You have countries that have the prevalence of 1% of patients with Chagas disease, that you count a few dozens of cases of deaths that are attributed to Chagas disease. So you do not know exactly how many persons are infected and are living with the Chagas disease, but also you do not know exactly the number of lives that are lost by Chagas disease. So the burden is underestimated, and we have a lot of uncertainties on this theme.
And why is it important to know this data?
Because when a policymaker, a public policymaker, a health minister or a health department secretary has to make decisions on how they will invest money to improve the health of the people living in this place, they have to consider the burden of disease. They have to consider how many persons are affected by the disease, if people are dying for this condition or not. If you do not know exactly how many persons you have infected with Chagas disease and how many persons are dying due to Chagas disease, we will not have attention from the policymakers to do the adequate actions for improving the situation.
And the importance on the Chagas cardiomyopathy in this context?
Yes, this is another very important question, because we have sometimes a lot of effort, many efforts for reducing the vectorial transmission or to the control of the vector, but you do not have effort to this very important part of the infected population that have heart disease. That's near 1/3 of persons in most studies, and 1/3 of this group of cardiac patients, they have severe heart disease, that they need exams, they need drugs, they need heart procedures, and if you do not consider that they are there, you will not be able to provide
to help them.
Yes, to help them, to take care of them.
And what do you think it could be done?
Yes, one thing is to have better estimates of the burden of disease, and this is an action, a collaboration between UFMG, the Federal University of Minas Gerais, the World Heart Federation, and Novartis Global Health to better estimate the burden of Chagas disease. It's a collaboration of the University of Washington, the IHME, Institute of Health Metrics and Evaluation, in order to get improved estimates of the prevalence of the population at risk, the number of deaths, the mortality, and the burden of disease itself, but also about the economics, how much it costs to take care of Chagas disease patients in general, in specific for cardiac patients. So it's a large project with a collaboration with different researchers from different institutions in order to have a better estimate of this very important data.